Over 1 million Americans have died from drug overdose since the year 2000. That's more than who died in Vietnam. And no one in the policy conversation is really asking the deeper questions around, but how is the substance helping them that it can guide treatment? And we need better treatment. The data around our treatment outcomes is quite discouraging. Welcome to this episode of the Biology Trauma Podcast. Dr. Kevin Sabet is here with us today. I'm so excited for this. I've been a board certified addiction medicine physician for years, and this is so near and dear to my heart for all of the people hurting, not just those with an addiction, but their families, their friends. And I think that this brings a really good conversation to the table around what can be done and what has not worked and what could work. So welcome, Dr. Kevin.
Thanks so much for having me. I appreciate it.
Now, you have been working with policy for a long time. And what would be some of the misunderstandings that you see that people have about an addiction that is influencing policy?
Yeah, great. It's a good question. There's a lot of misunderstandings, I think. One of them, and this is top of mind for me because it's in the news a lot and we've been writing a lot about it, is around what I think is the most misunderstood drug in America. And I'm not sure if your listeners are thinking about what that might be. There's a lot of drugs that are misunderstood, but the most misunderstood by far is marijuana. And it's the elephant in the room that a lot of folks don't want to talk about because they say it doesn't kill anybody, even though there are tens of thousands of people who die from car-related crashes, as well as psychosis, suicide, schizophrenia, accidents, other accidents related to THC. But it's a lot more than just the death. The issue with it is that today's marijuana has been genetically bred and been to be much more potent than in the past. And we are sliding toward a national policy of legalization when the reality is, I think we're caught in a false dichotomy between legalization and criminalization, that the only way to deal with it is either lock people up or legalize it the way we're doing right now. And I would argue that both of those things are not the way to go. I can talk a lot more about that if you want us to talk more about it later. But so I think marijuana is one of the most misunderstood, that you can't get addicted to it, that it's not harmful. I think is extremely misunderstood today. I also think there's this issue of that some people think in addiction that you have to hit rock bottom in order to get help or in order for help to work. And I think the reality is that might be the case for some people, but I think that there are so many pathways to recovery. And I think for a lot of people, it's not about hitting rock bottom at all. It's about having people around them, whether it's employers, family members, institutions, really, to nudge them towards getting help and this idea that you can only get help if you really want it. While that's obviously ideal for the person to want it, we know that's actually not true, that people can get help when they don't want it and they get recovered all the time, even when they didn't think they were going to. I think that's a huge myth, that people have to want it and that they have to hit rock bottom, are these kind of twin myths. There are probably a lot more, but those are the things that come to mind.
Yes. And as I think of the years working with addiction medicine patients, the effect that I saw of marijuana on the body is shocked me then when people would still have this understanding of it, that it's harmless, that it's not something that you can become addicted to. It's not something that is really changing your biology, but yet it very much is. And so when we met in NADAC in Seattle earlier this year, that's really one of the things that spoke to me about you and your perspective and why I wanted to have this conversation. So as we look at what then are some of the policies that have not actually been helpful, you even state something quite strongly, that it's not just the drugs that have been killing us, it's our policies that have been killing us. What do you mean by that?
If we look at, this is what I write about in my latest book called One Nation Under the Influence. If you look at the extent of the issue, we tend to only want to look at overdose deaths. We have to remember, for everybody that died, first of all, they have a family. Everybody that died has a family. And those people are affected forever. So that they're affected. We don't talk about them at all. For everybody that dies, there's 10 others that they were revived with Narcan, for example, but not permanently, but they're severely disabled as a result of their addiction. So they're affected, their families as well. We know that for everybody who does get revived with naloxone or Narcan, that 15% of them will die anyway within a year. And the accidents and the other things that come with, not just on the road, just in life, workplace and everything. All of that we forget about it because we focus very much on the deaths. Obviously, we want to also be focused on the deaths. I'm not trying to downplay death. That's the worst outcome of all, obviously, but we forget just how extensive the issue is. And I think as a country, we came together, and obviously hindsight is 2020. I think it's very easy to say all the things we did wrong, but more or less we were united as a country during the COVID-19 pandemic, at least in the beginning, in terms of what needed to happen and what we wanted to do. Everybody at that point, again, now it's controversial, but everybody at that point, they wanted a vaccine. That's why President Trump did the what's it called, Operation Warp Speed. There was a universal sentiment that we wanted to figure this out and wanted to get out from under it. And we put all of our resources. We closed schools. We did very extreme things. We mandated vaccines. We didn't allow people to come if they didn't. We did all kinds of things that we felt. Now, again, I'm not having the discussion whether those are good or bad. That's not what we're talking about. But the point is, we did that as a country. We came together. This issue has touched at least as many people, if not more people. And we have not actually come together as a country in terms of what we should do. And that's pretty incredible. That's, to me, it shows how we're not taking it as seriously as we should because we have so many opportunities to actually make a difference. See, it's very easy to get hopeless. It's very easy to look at these numbers and say, oh my God, nothing works, can't do anything. The reality is, and I talk about this in the book a lot, it's one of the main themes, we actually know what works. We could solve like 80% of the problem if we wanted to. And it wouldn't even cost, we've done things much less effective, much more expensively. So that's not, the cost wouldn't be a thing. If you look at, for example, the criminal justice system, 70% of people in and out of our system have a drug problem. We're not addressing it there. And we could. We have things that we know work that we could do. There's all kinds of things that we're not doing. So it's really a call to look at what are the things that work, both in the United States and around the world, and how can we implement those things?
And looking at the history of the policy around drug use, was the war on drugs really
Yeah.
the first thing that happened where it was this messaging around, well, just say no and we're going to do this
Mm-hmm.
war on drugs?
Mm-hmm.
Or was there a big focus before that as well? What's been the historical context to lead us to where we are today?
We had all drugs legal at the turn of the century, essentially, at the turn of the 20th century. And cocaine was used in all kinds of remedies and wines and all kinds of things. Opium was used as well. Then we realized that people were having problems with it at the turn of the century. And that's also where the modern alcohol prohibition movement started at that time. And there was a real push to get more knowledge out there. And so the first anti-drug laws were passed about 100 years ago before we used any war terms or anything like that. And the world actually, in some ways, came together 100 years ago or so in Shanghai and in other places where there were a dozen or so countries saying we need to work together on this, which is pretty amazing because the world obviously wasn't as connected as it is now. It's an understatement. It wasn't really connected at all. And there was a move, there was an understanding that this was a big issue that needed to be tackled. So we did that. And then we did pass some very harsh laws in the 50s, actually. So before Richard Nixon, before all of that. And I think there was then the counterculture movement of the 60s and 70s that was all about psychedelics, marijuana, etc. And then there was a real backlash to that in the early 80s. And just to back up though, in the 70s, what was interesting in the late 60s and 70s, the phenomenon you had this sort of younger generation that was tuning out and Timothy Leary and all of that. And then you had the Nixon generation that was very anti-drug. And although Richard Nixon was extremely vocal in his rhetoric, he didn't say war on drugs actually, but he said public enemy number one, and he did use war terminology. He actually, maybe your listeners, this will be the one of the things, or maybe the only thing that they've never heard before, or they take away from this, but I think it's pretty interesting. He actually had the most treatment-friendly drug policy of really any president. People don't realize that behind the tough rhetoric was a lot of funding and attention, especially toward sort of criminal addicts, heroin addicts in Washington, D.C. And as part of Nixon's goal to clean up Washington, D.C., he wanted to help them. And his experts said, you need to expand methadone, a medication. And he did in a very big way. And so people don't realize that Nixon actually had a very bipartisan and maybe progressive drug policy, which was really interesting behind this kind of veneer of this is public enemy number one. And then when the 80s came around, there was a backlash to the 60s and 70s. And that was when the just say no and a lot more of the drug war rhetoric amped up. Also, it didn't hurt that crack was becoming, crack was new. It's a new way of using cocaine. Crack is basically cocaine and you baking soda in the oven. That's what it is. Nothing that difficult. Because that was smokable as opposed to snorting it, it would hit the brain a lot faster and produce arguably a bigger high quicker. And that was why it was so scary then. And so there was a big effort, obviously, because of crack. It was like, oh, our crack's going to go to the suburbs and all of that. There was this big effort. And that was when we saw also increasing of incarceration as well. And then again, and then there was a sort of other backlash in the 90s, 2000s, and sort of you could argue now maybe of that, where we're realizing we don't want to be throwing everybody in prison for addiction because that doesn't really make sense. But what we want to do is have more of a comprehensive approach. But this is all happening in the background of a very radical drug policy experiment, I would argue, with mass commercialization of marijuana. It's beyond the legalization. It's not about adults using in the privacy of their own home, really. That's part of it. That's not the big part. The big part is the mass commercialization of marijuana. And so that's where we are today. So we're going back in time over 100 years ago when we really had no laws around it. And that's where I feel like we're going.
Yeah, and these are some important terms for people to understand. The difference between decriminalization,
Yes.
legalization, and commercialization.
Yeah.
Can
Yes.
you provide the scope of those for people? Especially because, again, what you've shared, I don't think many people really understand those terms
Yeah.
in way from a policy standpoint to really understand, like, when I talk about this, when I say that I'm in favor of decriminalization, this is actually what I mean when I say that.
Yeah.
What are the policy meaning
So
words?
that's a huge issue. Terminology in this discussion is so important. And let's talk about a couple of those examples. You bring up decriminalization. That's a word that means a million things to a million different people. If you look at the headline after Colorado legalized marijuana and you look at the Denver Post headline, it actually says Colorado decriminalizes marijuana. And it was like, wait a minute. No, they already had decriminalization. People weren't going to prison in Colorado for decades for marijuana. They already had decriminal. So when I say so it's important that we define these terms. So when I say decriminalization, I talk about that's the removal of criminal penalties for the use of the drug, whatever drug we're talking about. And so we have actually had a de facto decriminalization policy in most of the United States for a very long time. This is a huge myth. People have not been going to prison for marijuana use. There's dealing, that's different. There's sort of probation and parole violations that can be different. But in general, have not, that's a big myth that they've been going to prison. And I don't know anybody, including those on the right, actually, that would say we should criminalize people who have addictions. That's not a mainstream idea anymore. Now, there are people that, want to, that where they're committing other crimes and actually they're under the influence of drugs. And that's like a drug related crime. But that's different. They're in prison or being arrested because of their crime, not because of the drug. Now, so I do think that's very important. Now, of course, obviously, prosecutors and police use drug possession as leverage to for all kinds of things. Like that, I'm not saying that's de facto decriminalized in America, all drug use. Of course, it's not. But people are not also even in prison. Forget about marijuana. They're not in prison for the simple crime of also using drugs either. That's not really a thing anymore. It might have been, but it's not really a thing anymore. And so it's actually become a lot more universal, the idea of decriminalization now. But if you were to ask those very same people, do you believe in drug decriminalization? They'll say no, because when you say that, it evokes something very different. It evokes what happened in Oregon, which I talk about in my book, which was an unmitigated disaster. And in Oregon, they decriminalized all drugs. So it was like, okay. Again, nobody had gone to prison in Oregon for drug use in a very long time. It's one of the most progressive states in the country. This was not a place people were putting people in prison. Police were putting people in prison for a small amount of drugs. This just wasn't happening. But they passed a decriminalization law called Measure 110 in 2020. And what that did was send shockwaves, send a big message that you can use drugs whenever for whatever reason. And that led to open air drug use and all kinds of problems that they then repealed that decriminalization just last year. Now, that doesn't mean that people, again, that doesn't mean that people are going to prison for drugs in Oregon anymore now, because they weren't before, so they're not now. But it means that they can use the criminal justice system as leverage to get people treatment. And I think that's actually very important because it goes back to what I was saying about addiction. Addiction is a disease unlike any other in several ways. One way it's unlike any other is that it responds to incentives. You can't bribe a multiple sclerosis patient to not have multiple sclerosis. Like you can't say, if I give you $1,000 in a job, can you get rid of your multiple sclerosis? No, you can't. I can't bribe my 95-year-old grandmother-in-law who has dementia. I can't bribe her into remembering my name tomorrow. It's not going to happen. But with drugs, I don't want to say bribe because that sounds bad, but as an incentive, you can actually do that. It's incredible behavior, the way that behavior can change with incentives. So in Hawaii, they have a program called Hope, which is in probation. And in the probation program, they basically say if you don't take a drug test or you test positive, we're giving you 2 days in jail. Not 20 years, not 2 years, 2 days. And that has been that threat, the fact that it's actually going to be followed through. See, in probation, you're supposed to follow through, but it's never followed through. It's never that there's not enough resources. It doesn't like, it's like you're either going to prison for 5 years or a year or something, or you're not going at all. It doesn't make sense, but that's how in practice how it works. That's why it's such a failure. But in Hawaii and many other jurisdictions, as I talk about in the book, they've been able to modify behavior with these incentives. You can't do that with any other brain disease. It's really difficult. Like you can argue maybe obesity, maybe with diet, like we'll pay you if you don't eat something. I've seen a little bit of that, but generally it doesn't really work. Whereas with addiction, it's different in that. So that's a whole other issue is do we call it a disease? Do we not? There's so many implications with that as well. But I do think it's really important to be firm on the terms as you're talking about. The other term that also means a million different things, if you want to talk about it or whatever, is harm reduction, which we can talk about if you want. But that's something that I would see in the policy circles that I would run in, people arguing with each other, yelling at each other about harm reduction. And then when you said, do you agree with naloxone? They both said yes. Okay. Do you agree with medication assisted treatments? Yes. Do you agree we should meet people where they're at in the beginning? Yes. So they were already agreeing on 70% of things. Now, maybe they weren't agreeing on supervised consumption sites or pharmaceutical supply programs where you give current addicts like a pharmaceutical grade opioid so they don't go on the street. doesn't really work well, but it's another policy that's out there. Like they might not agree on some of those, more like on the fringes, but at the end of the day, they were arguing because their understanding of this term was different. And so terms really do matter.
Absolutely. So what does the term legalization actually mean?
Yeah.
Is that the
Again, that
same as
matters because
criminalization?
yeah, so it's different than decriminalization. So what I would say is legalization is the sales, manufacture, use, possession of whatever drug you're talking about. I do think it's so that's different than commercialization, as you mentioned. However, in America, it's not that different. So then now it gets even more confusing. So now we're trying to say that these terms mean different things, but some of the terms actually do mean the same thing, like in reality. So
In
in the
the
United
practice
States,
of it. Yeah.
in the practice of it. So in the United States, legalization means commercialization. We're not a socialist country where we're going to have the state have a monopoly on the supply of marijuana sold at cost with no advertising, with THC limits, proper labeling. It's just not happening here. So here, when we legalize, we really commercialize. What that means is we turn it over to massive corporations, marketing powerhouses, K Street lobbyists, that kind of thing.
Right. So this is the effect that we have when we are out on the streets and now we see it promoted, we see it marketed, we see it on billboards, we see advertisements for it. And we are wondering, like, how did this become our world? That was part of the process of just making it legal, is
Yeah.
that then just prompted all of these businesses to be like, if it's legal, let me now make some money around it. And
Yeah.
this is the same beef that I have with how they market pharmaceuticals. It
Right.
makes me mad to see these commercials that are promoting, like, oh, you'll feel your best, you'll feel happy,
Yeah.
all of your problems will go away. Now, the side effects could include suicidal thoughts and dementia and all of these other problems, but
Yeah.
it's in the fine print and they cover it so quickly while
Yeah.
they're still showing you pictures of all these happy people who are taking the medication.
That's right.
This kind of stuff should not be commercialized.
That's right. That's right. Yeah, no, we're very good at commercializing things. We're very good, and that's what we are very good at doing in this country when it comes to anything, when it comes to sugar, when it comes to anything. We're very good at it. And that's my worry with marijuana is that we've really gotten into this marketing business of it. And the reality is it's not getting the revenue that it was promised to bring in for the states. It's not getting rid of the black market, which was also promised. We were told we would get rid of all the illegal transactions because now you could go to a store. That's not happening. It's not keeping it away from kids. Kids are using more than ever. It's not lowering other health harms. We have more psychosis, schizophrenia related to marijuana than we ever have. All of these things we were promised for so long we would be getting, and we're not getting any of those positives, and we're getting a lot of the negatives.
I'm really concerned about the adolescents. Are you
Yeah.
concerned about the adolescents, Kevin?
Yes, and what's interesting because today's adolescents are generally the one, if you look at just prevalence, they're using drugs, alcohol, and cigarettes less than any other generation, which is great. They're drinking way less. Cigarette smoke is way down. Obviously, vapes have been the substitute. But with marijuana, it's still stubbornly high, but I think it would have been higher if it wasn't for just this general like adolescents that are going down in terms of use. The problem is those that are using much heavier than they ever were. And so the intensity has gone way up. And that I think is very worrisome because the brain is obviously developing until at least age 25. And so today's marijuana, because it's so strong in the THC, it's binding to these receptors in the brain and the rest of the body and really increasing all of these rates of addiction and psychosis and all these things that we're seeing now. And that is what worries me. It's changing the brain permanently. And it's reducing IQ, it's hurting other in terms of learning, etc. So I do really do worry about that.
Now, there are other substances, and we've heard a lot in the news about opiates. And in fact, just yesterday, President Trump came out with a kind of a strong message around fentanyl and it being a weapon of mass destruction. That's pretty strong language for the
Mhm.
seriousness. Where do opiates fit into your picture of one nation under the influence?
Well, obviously they're part and parcel. They're the leader of the pack in terms of what's killing Americans and what's causing a lot of the death and destruction. But I think that we have to be very careful not to talk about one drug over the other because today it's fentanyl, but it's not really in in more mature fentanyl markets. We're now talking about other kinds of opioids we've never seen before that are not that's not fentanyl. So there's all it's we can't really look at this drug by drug. These are all intertwined. The vast majority of people with addictions have a polysubstance use issue. So they're addicted it's more than just one drug. It's all together. And so when we commercialize one substance and relax it over here, like with marijuana, we can't imagine that it's not going to have an effect over there. Also, notwithstanding the fact that over 95% of anybody using cocaine, heroin, or any opioid did start with marijuana and alcohol because they're so ubiquitous. But yeah, I think fentanyl is a huge part of it, but I'm very careful not to only make it about one drug, even though it's a game changer, fentanyl, even though in terms of the deaths, it's by far the leader. When you look at deaths in Europe, because Europe hasn't had fentanyl like we have, they have 8,000 deaths a year, all of Europe. And look at us. So obviously it's a game changer, but I'm also careful not to only just look at one drug or the other.
I remember when fentanyl really came onto the black market. And in my practice, it had primarily been the heroin and these other substances that were causing the overdoses. And all of a sudden, we started seeing these deaths from substances that weren't supposed to be causing overdoses, things like meth, things like the marijuana. And then that's when we discovered they're being laced with fentanyl. And so you don't even know what you're taking. And now you're taking this really strong opiate. And I remember the panic that it created among us professionals of we don't even know what they're taking because at that time we
Right.
didn't even have testing for fentanyl.
No.
And as we look at the overdoses that it creates, I remember, and one of the things that has come full circle for me even lately, I'm curious your thoughts on this, but we had addiction physicians starting to recommend just marijuana, as
Yeah.
the way to help abstinence from opiates.
Yeah.
And at first, I really struggled with this because, granted, like my background before I really came into this and saw the reality of an addiction, I had been one of those like very rigid by the book abstinence and based on my background. But coming into it, wow, I had come to such a different perspective. But I really struggled with no, I cannot, knowing what I know about marijuana, say that yes, that's essentially your new substance that you're just
Yeah.
replacing one for the other. But there are still addiction medicine professionals who are
Yeah.
recommending that today.
Yeah, it's really too bad. I think it's horrible that they're actually recommending this. It's unbelievable. There are some isolated studies that are very badly done studies. They suffer from something called an ecological fallacy, which is that they basically look at states in general that have legalized marijuana and they say, oh, okay, the overdose rates are lower in those states. So therefore, if you legalize marijuana here, you're going to get lower opioid overdoses. And that's the reason that's an ecological fallacy is that's a mistaken reasoning where you assume that the findings about a group, let's say the country or a city or a state, whatever, automatically apply to the individuals in that group, even though group level patterns don't always reflect those individual realities. That's the best way I can describe it. So they said if a country with high coffee consumption has low heart disease rates, it doesn't mean that coffee drinkers within that country have a lower risk for heart disease. The group level correlation might hide opposite patterns. So non-coffee drinkers could have even had a higher risk. So this happens when you aggregate data, you lose individual variation. And this is what's happened in the very few studies that are out there that say, "Oh my God, this is so good for in legalization states for opioids." And so that's this huge fallacy. And so I think some of those doctors are looking at those studies and making these totally incorrect conclusions from them. When you look at the studies that actually look at individual people, not the group, but individuals, And you say, okay, individuals within states that have legalized or individuals who just use marijuana. And if you use marijuana, you're more likely to be in the legalized state. So that holds. Or if you're in a legalized state, you're more likely to use. That holds. Either they're both directions make sense. When you look at those individuals, actually, it says you are more likely to use opioids later, not less likely. You're more likely to die of an opioid overdose, not less. You're more likely to have longer days in the hospital. You're more likely to have failed treatment. All the negative things that you wouldn't have wanted, you're more likely when you use marijuana, when you're using the higher THC marijuana. So that's just a huge, I think, mistake that some physicians have taken to, and it's really too bad, I think.
Yeah, I think it's harming the way that we want treatment to be going. So you've had the opportunity to look around the world and see other policies and see other ways in which other countries are doing this. What have you
Right.
seen that actually is working for other countries?
So I spent some time in Iceland, believe it or not, where they've come up with, it's not rocket science, but they've implemented prevention in a way that makes sense, basically giving kids alternative activities, wellness, understanding the environment that they're in. So it's not just about school lessons, don't use drugs, but what's going on at home, what's going on at their work, what's going on in society in general, in their community. And countries like that have implemented these sorts of things have seen huge reductions in use. So I looked at that. I looked at what's happening with drug treatment courts in our own country and how we can make them better, because those are specialized courts where judges, again, it's about incentives. So the judge basically says treatment or jail, it's your choice. And that, again, is very powerful. It's a very powerful motivator for people. And that's where the disease of addiction model, if you say somebody has a chronic disease that they're always going to have, it doesn't grasp the fact that they don't always have to have it, actually. Like, yes, I understand the traditions and that's putting that aside for a minute because that's important. And I'm not talking about that. Because if you follow this logic that it's a chronic disease like this, then you think that there's no way out of it. And actually, some policy leaders have said that. They've said this is a chronic disease, unlike alcoholism, which people can overcome. They can't overcome opioids. And that's very dangerous. That's very hopeless and dangerous. So I looked around the drug courts. I looked at Portugal. Everyone talks about Portugal. So I went to Portugal. I talked to the drug czar in Portugal. They said, please, Kevin, tell everybody we did not legalize drugs. It's not what we did at all. We first and foremost invested in treatment. Then we created an administrative system. If you get caught for drugs, you go through that system as opposed to the criminal system. And in that administrative system, you're there to be assessed by a panel of 3 to 5 people, or 3 people usually, and they decide whether you should go to treatment or what you should be doing. And that's what we've done. And it's very different than legalization because when Portugal implemented that, in America, a lot of people said, oh, they legalized. And they didn't actually legalize. So that was important to go look at. And then I live part-time in Vancouver, BC, Canada, which is the highest overdose death rate in the Western Hemisphere. And so I walked down the street, literally down the street, 10 minutes from my house to see what was going on. And it was some of the most horrific sights I've ever seen, right down the street, right next to multi-million dollar high-rise apartment buildings owned by Chinese investors. It's unbelievable. And they've really doubled down on this concept of harm reduction. But really, what I argue in the book, a concept that has been twisted, not the original sort of harm reduction, but a concept that really it meets people where they're at, but it leaves them there. I want to meet people where they're at and take them to a better place. That's what we should be doing. And what we hear instead is you just have to meet people where they're at. Let them tell you when they're ready for anything. If we're going to wait for people to be ready for something like sobriety, ready for recovery, which is really hard, we're going to be waiting forever. Because to most users, nothing's wrong. Why would anything be wrong? It feels great. You're taking a substance and getting a feeling that the best sex, the best food, the best roller coaster, the best award, none of that matches. None of it. And so why would you want to stop? And so this idea that we have to wait for people to tell us they want to stop, Yes, there are some people that see their world crashing and they wake up. Yes. But a lot of people do not because they feel fine until they're faced with some kind of ultimatum. George W. Bush was a raging alcoholic until his new fiancee, Laura, said very famously, you got to choose. It's either Jim Beam or me. And I'm not going to give you another chance. That completely changed his behavior. Obviously, it changed the trajectory of his life too. He became president. He wasn't going to become president. He was an alcoholic in his mid to late 30s with a lot of money and a lot of time and no direction. So, by his own admission, learning about how to get people to the place where they do respond to those incentives, I think is really important. And that was also part of the journey of this book.
Yeah. And that was one of the reasons why I wanted to come and speak with you, is to support your book. You have written a phenomenal book, One Nation Under the Influence.
Thank you.
What was your hope to accomplish with this book? What is your dream?
My dream is to change the minds of policymakers, to have them actually act instead of just talk. So there's a lot of talk about mass destruction and a lot of talk about a lot of heavy rhetoric everywhere. We want to see it backed up with budgets, backed up with plans that are implemented. This is what's very important. So it's really in some ways aimed at decision makers, but also the public to get their policymakers and politicians to change. Because sometimes it's only the public that will actually get that change. And so that's my dream with it.
Yeah. I highly encourage the book for all of you
Thank
listening.
you.
This is a phenomenal book, and given my experience in that field, this is the hope of how do we
Thanks.
actually change treatment and outcomes. Again, like you were saying, Dr. Kevin, not just for the person who struggles with the use, but their families. Every one of those has families that are hurting, watching their family member, or in other ways being hurt by their behavior as a result of their use. I am so thankful that Dr. Kevin was able to come and share with us. And whether addiction has touched your life directly or through someone you love, I am so sorry. I find addiction is one of the hardest things for someone to either experience or to watch. It's encouraging and discouraging to me to see that we know what works. The research is there, the models exist, and that does give me hope. And hopefully I can be part of the implementation. I will have links in the show notes to connect with our guest and his book, One Nation Under the Influence. And I'll also include a link to my guide on the 3 most common biochemical imbalances found in addictions to know which labs you should be asking for. I'm Dr. Amy. Until next episode, lots of love.